I think this really represents a paradigm change in how to manage cholesterol, recognizing that this is just one set of guidelines that could continue to evolve over the next couple of years too. But the paradigm change is, instead of treating to a goal value, to treat with primarily a regimen-based approach. And pharmacists really need to understand the philosophy behind it, in which this is a recommendation from an expert organization that's evidence-based. So it's really making recommendations for treating patients based on what's proven, not what is thought to be best by interpreting information and reading between the lines, but really sort of a literal approach to seeing what's proven to be good and extrapolating it to your patients in as direct of a manner as possible. With that said, pharmacists need to know the information that's in these guidelines. They also need to know information from other consensus recommendations from other organizations, which may challenge this approach. And by knowing some of both sides, the reasons to support this new approach and the reasons to criticize this approach, I think allows pharmacists to view the overall treatment paradigm as being going with these new recommendations as a good first step. And then in patients who need step 2 or 3, which is after implementing basic proven therapy, perhaps that's a role for pharmacists to know how to do things a little bit differently, and maybe adding on another drug that may not be clearly called out in a guideline, or treating to a specific level that's beyond the first step of using either moderate intensity or high intensity statin therapy.